So palliative care is an approach that improves the quality of life for people and their families facing a life-limiting illness. So very much that comment before, it extends beyond the person with a life-limiting illness to include family and perhaps carers as well within that situation. It's supporting a person to make the best choices that support their and emotional, spiritual, intellectual and cultural well-being. So when that comment was put in the chat around whole person, it's very much not solely looking at treating the illness or treating that life-limiting condition. It's about looking at the person in a very holistic manner. What are their physical needs? What are their needs emotionally and spiritually? And spiritually includes their religious beliefs as well, their intellectual needs, and also their cultural well-being. And cultural well-being quite often becomes a very important factor. Palliative care addresses the physical, the psychosocial and spiritual needs of people with a life-limiting illness to allow them to live as well and as comfortably as possible. And one of the things I think that stands out for me in all of that is the fact that for support services or for a palliative care team, for your carers, for your families to know how to best support anyone who has a life-limiting illness, one of the things we actually need to do is communicate that and to share that information with our families and our carers and our communities in a way that's comfortable, so that not only we can perhaps ask for that help and assistance, but that people can offer that to us as well. And perhaps not only even verbalising it alone, to be able to document some of that information. So we'll talk about that a little bit in a moment. Why don't we know more about palliative care? That's a very big question. Probably have a whole session just talking about that. For a lot of people, palliative care is something that we haven't necessarily had contact with before. In my experience, people in their 30s, 40s, sometimes early 50s haven't had the experience of losing someone close to them and being part of a situation where palliative care may have been a contributing factor. So many reasons why we don't know. Sometimes because we're too scared to ask. We're not sure about what we need to know. We're not sure where to go to get that information. So let's have a look at some of the things that perhaps people believe and the truth that sits underneath that. First myth for busting: palliative care hastens death. And this is something that actually as a younger person I held a belief around myself. Palliative care doesn't hasten death and it doesn't also prevent death. Palliative care does provide comfort and the best quality of life from the point of diagnosis of an advanced illness until end of life. And there's a couple of points just within that. For us, or for palliative care to be able to do that job well, for the palliative care team, for doctors, for support services to be able to do that well, it does rely on people contacting palliative care. So getting a referral through your doctor, through your healthcare services, to be able to access that service early in the diagnosis so that people can actually, those supports can move in, they can engage with you as an individual and a family member, and also with your family as well to determine what it is that will bring you best comfort and quality of life. Second myth down the bottom there, palliative care is only for people dying of cancer. And I think from my own experience, that's where I actually heard about palliative care talked about most. But it's an incorrect thing to actually think that only applies to people with cancer. Palliative care can benefit patients and their families from the time of diagnosis of any illness that may shorten life. So that can be an illness with a trajectory of many years. There's an opportunity for palliative care and the palliative care teams to come in and be of support to families in a very meaningful and a holistic way. Let's have a look at a couple more myths. Palliative care only provided in a hospital. Palliative care itself can be provided wherever the patient lives. So that may include a home setting, It may include a long-term care facility, aged care facility, or a nursing home, as people may call them, in a hospice situation, or in a hospital itself. So palliative care are mobile. They will come to where the patient or the person is who has that life-limiting illness. My experience has been when my father was very ill, palliative care addressed his needs within a hospital setting. For my mother, when she was dying, she was referred to a mobile palliative care team who came to see her in an aged care facility. So very different settings. Palliative care also will support families and people with a life-limiting illness in their own home. So it leaves people with choices around where they choose to spend their time when they're facing that illness and the diagnosis and the treatment. The next one down the bottom there. Did I just bump a screen then? No, I didn't. There we go. Palliative care is only provided by doctors and nurses. The palliative care teams are a collection of people with specialities. They can include allied health in many forms, perhaps physios, people with a variety of skills, as well as doctors and nurses who can contribute to someone's well-being. So palliative care can be provided by medical specialists, but it can also be provided by community. And when I say community, it could be that people from circles, networks, connections in that person's community can come in and be part of that broader range of care. And we'll talk about that in a moment, because it's something that a lot of people don't realise and can forget, and it is a valuable resource. A few more myths. Taking pain medications in palliative care leads to addiction. And this is something, as an allied health worker, I've heard a lot. So the purpose of medication is to keep people comfortable, and that often requires increased doses of pain medication. And that can be for a variety of reasons, but it's most commonly the result of tolerance to medication as the body adjusts. It's not an addiction. So a medication, for example, that's being given can be considered by the body at some point to be a normal level. And once pain or other symptoms change, those medications may need to be adjusted with the sole purpose of keeping that person comfortable. So it's providing quality of care. And down the bottom there, palliative care means my doctor has given up on me and there's absolutely no hope. That couldn't be further from the truth. I'm just going to move my bottom screen up. Palliative care ensures the best quality of life for those who have been diagnosed with or are experiencing an advanced illness. So it's actually a referral to palliative care opens up a wealth of opportunities in terms of being able to access support services, other medical services that can support that person's quality of life to be the best that it can be during that end-of-life journey.